University at Albany, and to be joined by several local and state officials, including our Albany County Executive Dan McCoy, Albany Mayor Kathy Sheehan, Senator Neil Breslin, all great friends of the University at Albany, as well as DOH Commissioner Mary Bassett and DHS SES, I should say, Commissioner Jackie Bray. Yeah, all those acronyms, right? Our guest of honor, of course, has been many times here at the University at Albany, but this is the first time that we have the pleasure of welcoming her as Governor Hochul, and we are delighted that she is here with us. I've had the pleasure and honor of interacting with the governor since I arrived at the University at Albany in my capacity as co-chair of the Capital Region Economic Development Council. So I guess she was my boss then and she's my boss now, right? And today provides me another opportunity to thank her for her extraordinary commitment and vision as she takes the reins of the state of New York in these very challenging times, but with great opportunities. Congratulations on a major announcement this morning. This is great for the city of Albany, for the Capital Region, and for the state of New York, and for the country as well. I joined the governor on a tour of the RNA Institute, which has really become the epicenter of UAlbany's response to COVID as our in-house surveillance lab testing system. Thanks to the expertise and creativity of Dr. Andy Berkland and his team, and Andy is with us here today. Since the summer of 2020, the University of Albany, through the RNA Institute, has processed approximately 250,000 saliva samples for UAlbany and numerous community partners. From the very beginning of the pandemic, UAlbany has been actively engaged in the state's response. From April 2020 to April 2021, we hosted a state testing site that administered more than 160,000 tests. 1 year ago tomorrow, one of the first state-run mass vaccination sites opened here on our campus as well at the University at Albany. As a public research-run institution, UAlbany has also been very proud to play a leading role in understanding and addressing the pandemic through our research in public health, education, minority health disparities, social welfare, public policy, and emergency preparedness, among others. Of course, none of this would have been possible without the strong and continued support from our city, our county, and our state leaders. So thank you all so very much. Again, we greatly appreciate this administration's leadership and partnership as we continue to navigate this pandemic. So it is with great pleasure that I welcome to the podium our governor, Governor Kathy Hochul. Welcome, bienvenida.
Just a double mask serve many purposes. Also an opportunity to stay warmer when the weather's going to be very bitterly cold, which we'll talk about literally in a couple minutes. So first of all, Dr. Rodriguez, you always make me feel so welcome here. Your leadership here has been exceptional. And to know that this institution that I visited many times has played such a key role in how we're fighting back against this pandemic. And your willingness to serve as a vac site, we're reopening the testing sites. Certainly we came here, you have that available even when your students are not here. And you've done this for the community at large, and that is important to all of us. I thank you for that. But also this RNA Institute. This gives me a chance to put a spotlight on the fascinating work that's being done here by nation-leading researchers and scientists and doctors who are innovating all kinds of therapies and research into rare diseases. And I'm proud of the work they're doing here, but to know that they're also on the front lines helping us battle this pandemic by allowing testing to be done. And I'm going to show you what this looks like here, because I just talked to some of the individuals in the lab, there's different ways to analyze test results. This is one where we can do pool testing. An individual, usually students, will spit into this vial. I'm not going to do that, just so you know. That is not happening in this picture. But they spit in the vial, and then they can pool 4 at a time. So if they all come back negative, you immediately know that there's 4 people that are clear. If one tests positive, they can do it again. And this is what we've been doing on universities, and you've made this available not just to the students here, but through all the campuses in the region, so they can get very quick results and know exactly what they have to do. So I want to thank our team here at the RNA Institute, and thank everyone who's been involved with that today. I'm also joined by Dr. Mary Bassett, who you'll be hearing from in a couple of minutes, someone who gives me tremendous comfort and confidence to know that we have her at the helm of our health department, so thank her. And also Commissioner Jackie Bray, who wears many hats. That title of Director of Homeland Security and Emergency Services encompasses a lot, and you'll be talking about that as well. So it's delighted to be here as well. And again, I just want to acknowledge that part of our testing, our winter surge plan, is to make more testing available. So I wanted to come and see hands-on exactly what we're doing here as well. So great to be here, but also always happy to be in Albany, where I get a chance to spend time with my local leaders, starting with our Mayor, Kathy Sheehan, who was with me 3 times today now. This is great. We had breakfast with mayors from upstate to talk about our issues, where we can work together as I'm formulating the budget, as well as the big announcement at the Port of Albany. Dr. Rodriguez was there as well to talk about thousands of jobs coming to New York State, but literally right here in the city. We're going to be training them, giving them an opportunity, part of the energy future, and I announced that with Secretary Jennifer Granholm, a former governor of Michigan, so we had a lot to talk about. Also in our state legislature, Neil Breslin. I want to thank Senator Breslin for all he does. We have a very exciting session coming up. I'm energized, fired up for this, my first time in this position, so we're looking forward to that as well. So today is simply a matter for, I wanted to come do this tour. I wanted to have the media have a chance to see what's going on here, so you can put a spotlight on this as well. But also I just want to give an overall update on where we are. But before we do that, the weather. The weather comes through. It's all about the weather. And I don't know if you know this, when I was interviewing individuals to fill this very important position, which requires many talents, I had an opportunity to interview someone who had been the chief of staff to the National Weather Service in addition to managing the COVID response for the city of New York, and that is our Commissioner Jackie Bray. So anything related to weather, I'm turning it to you.
Okay, ma'am. Thank you.
Please just wear a mask here a second here.
Thank you, Governor. So we did want to just really quickly do a weather update before we talk about COVID. We've got 2 real weather events going on in the state this weekend. The first is that tonight into the morning tomorrow, there are going to be dangerously low temperatures across much of the state, really from the mid-Hudson region north and west. We've got wind chill in the negative teens. Up in the North Country, we've got wind chill in the negative 35, negative 30. These are the types of temps where frostbite becomes a real concern. Frostbite can develop in these temps within 10 minutes. It's important that New Yorkers take precaution tonight and tomorrow. That means covering any unexposed skin. It means being really conscious of how long you're spending outside. If you are going to use an electric heater, doing that safely, and of course checking on your neighbors as you are safely able to. In addition to the dangerously cold temps tonight, on Sunday we have a winter storm moving into the state. Sunday about 7 p.m. we expect that storm to start, lasting through about Monday at 7 p.m. We expect snow across the entire state north of the city, anywhere from 6 inches to just over a foot. New York City and Long Island are likely to see more sleet and rain than they will snow, but the winds are going to be a real factor here. We expect wind gusts over 45 miles an hour across much of the state. The most intense snow will fall between midnight and noon on Monday. So before you leave your house Monday morning, make sure you've checked your forecast. And that just goes for the whole weekend. Make sure you're checking local forecasts. State agencies are out in force. We've got over 2,000 plows and loaders ready to respond, and over 6,000 personnel ready to help maintain and restore power if we see power loss. Thank you.
Thank you. We were speaking among ourselves that it might not be a bad idea if someone wants to innovate flannel-lined masks. Certainly you could probably sell a lot at the game in Buffalo on Saturday night. Also, I was staring right at him. Our county executive, Dan McCoy, who's been at so many events with me. We went out and visited a site at the mall, Cross Gates Mall, not that long ago, and talked to the National Guard members there. And so I want to thank you for being the extraordinary partner. You and your health department have been on the front lines of this from the very beginning, and so I just wanted to give you a special shout out and tell everybody who's part of your team we're getting through this, and we're getting it through because of great work with counties like Albany. So thank you, County Executive. All right, so and I wanted to thank SUNY Albany, as I mentioned, the RNA Institute. You always hear about RNA. Nobody knew what it meant before this pandemic, and this is, and I'm not going to try to begin to explain, but I did have a chance to meet some of these individuals, as I mentioned, about our sampling opportunity, and a huge point of pride. And we're able to lure the director all the way from Florida to the better weather here in Western New York. And he tells me he loves upstate New York, and he tells me he likes it. So here's the news flash. Turning the corner. You heard it here first. I've been waiting to say that. Turning the corner. Look at the 7-day average of cases starting to decline. 49,027 cases yesterday. Our highest point was how long ago? 1 week ago. Highest to lowest in a week thus far, and that lowest is going to continue to go down. We had over 90,000 cases 1 week ago today. 90,000 people tested positive in the state of New York, 49,000 right now. So that is a very positive trend, and I believe we'll be able to keep that going. And I want to thank New Yorkers. Thank you for hanging in there with us through 2020, 2021, hopefully not too much of 2022, and it's because you got vaccinated, you wear your masks, kind of griping a little bit about it, I hear it, even in my own household sometimes, but you've all done the right thing. And that is why we'll be at the forefront of the states seeing this long-awaited, much-anticipated decline. So very good news. I have been waiting a long time to be able to say this. So turning the corner on the winter surge. Positivity is declining. We are now at 16.3%. Again, our peak was a few days ago on January 3rd, 23% positivity. Those were very high numbers, and at that point, we did not know whether we were going to continue up or we start going down. And it started going down, so very good news to hear today. Hospitalizations as well as deaths. We've known all along, we see this, that these are lagging indicators of positive cases, so there's no surprise. But we are starting to see a decline of our hospitalizations, down about 245 down since the day before, so that's good. More people out of the hospitals, better, still about 12,000. And they're still too high. I mean, 12,000 is not something that we are saying is a positive news story. It is still very high, but this will eventually catch up with the trend that's just beginning. So that's what we're talking about. And 177,000 lives were lost because of this pandemic, and that is still too high, and we pray and hope that that trends down quickly very soon. So we're expecting, let's take a look at regional hospitalizations as well, because upstate and downstate, a little bit different story here. Upstate is still not out of the woods yet. Downstate numbers are trending down. See New York City, Long Island at the top there. That's the trend you want to see. We're still having issues in central New York, Mohawk Valley, western New York's flattening out a little bit there. So we're watching those very closely, and that is why we took quick action when we realized that the high positivity rates, particularly in areas that don't have as high a vaccination rate, that is a bad combination. High infections, lower than should be vaccinations. That's the combination we look at. Then we look at hospital capacity, which you've heard me talk about nonstop through this whole process. And we had to suspend elective surgeries on a 2-week basis. Again, not forever, but on a 2-week basis. We evaluate it every Thursday and decide what we're going to do. And we had to look at a region now, so there could be more transports between hospitals. So one hospital may not be able to do it because they're below our 10% threshold, but other ones need to also have space freed up so we could transfer people to them, because otherwise we'd have no options. So we're just always trying to stay ahead of this. So we have non-elective surgeries in the Finger Lakes, Central New York, and Mohawk Valleys now temporarily. And we also started talking about a different metric, and looking at our hospitalizations. I believe we're the first state that recognized that, what people are being admitted for it varies between regions, but we started talking about hospitalizations of, were they all in there because people are that sick from COVID? Did COVID drive them to the hospital? Was it all COVID symptoms that resulted in them having to be admitted? And what we found out, at least a week ago, we started asking this question, and now other states are asking as well, are there people admitted for non-COVID reasons who always get tested? You arrive, you're tested, and happen to test positive but are asymptomatic. And that was a very important dynamic for us to just, another metric for us to look at, to assess the severity of the situation. So basically statewide it's about 42%. Right now it's 43, it's about 42% statewide when we started collecting the data. So we're going to start getting more information on that as well. So we'll see that. And how we know all this? Because we're testing. We're testing. And I don't know if there's another state that has as many tests secured. This is incredible. I said, I want every test that's out there. We've secured, I remember making the announcement, we're going to have 10,000 test kits. Oh my gosh, we're now going to have 13,000, up to 35, and then we went up to 49. 64 million tests. Now these are just the ones that are being tested at sites. We get them into schools, we get them in nursing homes, we get them in our facilities, places like here, congregate facilities. This does not include all the home testing that's going on as well. So it's hard to make an assessment of what that really means, because people are keeping that information generally themselves. But my theory is, and again it's just a theory, that people are doing home tests and they test negative, they're keeping that information themselves. Like, okay, fine, I'm good, I'm going back to work, I'm going back to school. And the ones who test positive at home are more likely then to present themselves just for a retest at an official site to make sure they can validate that. So there may be a higher number of people who would be negative tests, but we just don't have that data point. So all we have is the data to work with, what is officially collected, what is assessed at places like here at the RNA Institute, and that's what we're looking at. So we're going to continue getting more tests out the door, 15 million already out, 2 million more going to schools. Again, why are they going to schools? It's all part of our strategy, which was implemented before children came back to school after the winter break. So if someone in the class tests positive, they don't all have to quarantine for 10 days, disrupting all of them, which was what was going on for such a long time, to the detriment of these poor kids and the parents who thought they were going to get back to their jobs, who having their lives disrupted again, and the teachers just so uncertain with what's going on. So we give them test kits at school, they test at home, test negative, they're back in school. That's what the Test to Stay is all about. So we'll be giving more to schools very soon. And I also want to thank Siemens Health and Ears for their help in making this happen. This has been, as I said, a military-style operation in this company based right in Tarrytown. So we're taking advantage of our local companies and places like Pfizer, as I've mentioned before, calling them up, saying when you start selling your medication to more than just the federal government, remember you're New York residents. We want to get our hands on it first. We've already made those calls. So that's what's going on right now. I mentioned the Suny Campuses. This was a very good innovation on our part in terms of really scaling up this winter surge strategy, finding more places that were available, especially campuses that have been testing students in the past. Students are on break for literally a month. Why not use that facility? We'll ramp it up with enough tests. And so these are the sites we have now. We've just added 9 more community colleges: Niagara, Ulster, Monroe, Sullivan, Rockland, Empire State College, a Saratoga location, Alfred, downstate, and the Finger Lakes. Again, looking at where we have the highest need as well. And so that's what we're constantly doing at our, many times a day conversations about this. So I want to thank Suny and Quadrant, who's our testing partner on this as well. And we also have a partner in very high places, and that would be President Biden. We had a great phone call in December, His team engages with us every single week. I'm on calls with all the governors. We share them what's going on. They say, how can we help you? And I said, we need more ambulances. We need more medical help. And why is that? Because when you're in a densely populated urban area with lots of hospitals, okay, transfers are not that complicated. I'm up in Potsdam a couple weeks ago, and they said, we can't get people transferred to other hospitals because all of our EMTs are volunteers. They have other jobs during the day. They want to be helpful, but we can't take 3 hours to take someone and wait with them when they get admitted to a larger hospital in an urban area. That was the dynamic that we're fighting against. So President Biden answered the call, and I'll let Commissioner Bray come up again to talk about exactly what that effort looks like. Putting on my mask here. There's going to come a time we're not going to do this anymore.
I know, ma'am. I can't wait. I'm looking forward to that time. Thank you. Yeah, we wanted to just touch on thanking our federal partners and talking about the resources that they're bringing to the state. We have 2 disaster medical teams already here in Buffalo and Syracuse, and we want to thank our federal partners for extending the time that we'll have a federal disaster medical team in Syracuse. In addition, the President announced yesterday 2 more disaster medical teams on their way, arriving at the end of this month, first to Brooklyn and a second to the Bronx. We have, as the governor discussed, 80 ambulance teams. Each team has 2 people plus the ambulance already here. 30 of those teams are serving Western New York, Central New York, and upstate. We've got 50 of those teams serving our downstate region. We have 30 more of those teams arriving in state on Sunday. That'll give us 110 teams in total. And as the governor said, for our central, our western, our upstate regions, these are teams that are able to transfer patients long distances and stay with patients until they can be admitted. That really frees up our local EMS so that our local 911 response is not tied up in these patient transfers. Downstate, those 50 ambulance teams are actually integrated into our 911 response to keep the city's EMS and 911 response on time and available to serve everyone. We do want to say we continue to need additional federal resources, and we'll continue pushing to get as much as we can for New York State, particularly in our Finger Lakes regions. We're hoping to work with our federal partners to bring additional clinical staffing in, and those requests are in, and we work daily with the team to get as much as we can for New York. Thank you.
It's not an exaggeration to say we have them on speed dial. Is that right?
That's right.
That's right. That's right. Thank you, Commissioner Bray, for all the great work that you're continuing to do. One more thing I would like to bring Dr. Bassett to talk about is making sure people have access to health care during this pandemic, and we're going to do something to make that a little bit easier. So, Dr. Bassett.
Thank you, Governor. Before I turn to health care, which I'm really pleased to be talking about a broader subject, I do want to make sure that everybody remembers that COVID vaccination is entirely free. It doesn't matter what your health care insurance coverage is. It doesn't matter where you get vaccinated. The vaccinations are free, and we still need people to get vaccinated, especially children. But it's also very important that every New Yorker who's eligible has health care coverage. We want every New Yorker covered to the extent that we can achieve it, and we still have thousands of New Yorkers who are eligible for health insurance and haven't attained it. So today, the Federal Health and Human Services extended the public health emergency that was first announced on March 2020, and they have extended it from June 16th for a further 90 days. The New York State of Health, which is New York's official health plan marketplace, will remain open for enrollment as it has been since March 2020 and will continue to be open for enrollment throughout the public health emergency. And I'd like to remind New Yorkers of the fact that this marketplace offers a one-stop shop for you to get covered. If you lack health insurance or your health insurance is coming to an end, it provides access to the public health insurance options, Medicare, Medicaid, Child Health Plus, the Essential Plan, as well as a number of affordable commercial plans. Every single county in this state has both public and commercial plans available through the marketplace. It's been so important to have this access during the pandemic, when many people lost their jobs and with it their health insurance, or lost income and weren't able to afford health insurance. We've had a huge surge of enrollment during the pandemic, with 1.5 million New Yorkers added to the New York State of Health rolls. So with this effort over the years since the passage of the Affordable Care Act, we've cut the number of uninsured New Yorkers in half across every racial ethnic group. This is a huge accomplishment, but we still have about 900,000 New Yorkers who don't have coverage, and at least half of them are eligible for it. If you want to get coverage for March 1st, you have to enroll by February 15th. There are subsidies available so that the cost of health insurance can be greatly reduced. It's a bit complicated, so I won't give examples of how much, but it's substantial. So nobody should decide that they can't afford health insurance. Go to the marketplace. The tax credits made under the American Rescue Act remain in place, and there are substantial subsidies that can lower premiums. So that's the message today, Governor. Don't assume that you can't afford health insurance. We want you covered so that you can get complete health care needs. We want people vaccinated. We want them boosted. And we want people to be insured. Thank you.
Yes, I don't know how to put an exclamation point on that. Doesn't say she's right. There should not be 900,000 people in the state of New York without health insurance, half of whom are easily eligible. So help us get the word out. I look to our local partners and anyone who can amplify that message, because there's nothing more frightening than to be an individual who needs health care and you present yourself and you do not have that insurance card, you don't have coverage, and it's so unnecessary. The expansion of the Affordable Care Act, which occurred when I was a member of Congress a decade ago, created an opportunity for everyone to have the dignity of quality health care, and that is something we want to make sure continues on. So thank you, Dr. Bassett, for reminding us of that as well. So we know what to do. Recap, cases are trending down, turning the corner, and we have to continue being vigilant. Okay, we're not going to spike the football. Understand that? No spiking the football. It's all about continuing vigilant, be smart about it, vaccinations, boosting, wear the mask, and there will come a time when we say it's all over. We're not there yet, but boy, it's on the horizon, and we've waited a long time for that. So thank you, everyone, for all you do. And with that, we'll take any questions. Yes?
Governor, you've been criticized for doing campaign events that's on the same days when you use state aircraft to travel on official business. Why don't you reveal who you've been meeting with in some of these private meetings? And secondly, I have a question for Dr. Bassett.
Okay, sure. And I'm happy to answer that question. As I said on day one, my administration will conduct itself with the highest of ethics. Those are values I subscribe to: transparency and accountability. And I've told my team, follow the rules. And any area where it's gray, and there's a lot of gray area based on rulings that have come out, there's no gray in our lives. It's black and white. Err on the side of doing the right thing. So I've directed my team to go back, look at everything that we put out there. Again, no one's required to publicly put out their schedules, but we put it out there to make sure the public knows what we're doing. And so we're going to continue doing that and making sure that there's proper reimbursements where necessary. That's all been done. And we're going to go forward with the renewed sense that we have to restore people's faith in government. So thank you. Dr. Bassett, you had a question for that?
Yes, not about campaign stuff. A lot has been made about how Omicron leads to less severe COVID-19, especially among the vaccinated. How do you anticipate, what sort of effects do you anticipate on long COVID, and what is the state already doing now to proactively address it?
So it's true that Omicron causes a milder infection. We're seeing it in the lower proportion relatively to the number of people who found positive who've been hospitalized. But it should be clear that there are some individuals who get very sick from Omicron infections, and some will die. As you've seen, we've had some pretty high numbers of deaths. We don't know that much about long COVID. We're in the process right now of organizing a convening of various scientists from around the state who are working on this issue to begin hearing from them about what we're learning about long COVID. We don't know much about Omicron yet and long COVID, but there's no reason to suspect that it never occurs. So I just think that we should make clear that no one wants to get COVID, and no one wants to get Omicron, even if it's milder. And the best way to protect yourself and people around you is to get vaccinated. So we're having this convening. We're aiming to have it by the end of February. Thanks.
Next question. Thank you.
Given that we're seeing potentially, hopefully, a slower rate of COVID cases, are you reconsidering or evaluating the indoor mask rule for February 1st? As a follow-up on the insurance issue that was raised, there's been calls from insurers, from advocates, for undocumented New Yorkers to have access to health insurance as well. Is that something that your administration would consider?
And that's certainly, there's a legislative solution to that, and so I'm not going to be talking about legislative ideas right here and now, but in terms of the suspension of all of the requirements that have been put in place to help people keep people safe, which I believe has been very helpful to New Yorkers, yes, we assess this all the time. These are not done lightly. We don't do it arbitrarily. In fact, we put in an executive order to give me powers to ensure I could make sure we have procurement opportunities that otherwise would not be there, which is the reason why we're going to have a record number of testing kits, because those powers are granted literally on November 26th, when Omicron was first identified and first named by the World Health Organization. So we have been proactive. We've been making smart decisions. We have been putting in what we think are common sense requirements to protect the health, but they are all short term. And I cannot stand here today because I don't have the knowledge right now of what it's going to look like February 1st. I can't do that. So we're going to keep monitoring the situation and make sure that there's not a trend that changes quickly. But yes, there will come a time when we assess this, we'll determine how long any restrictions need to be put in place any longer. But in my opinion, the shorter the better, to allow people to feel liberated from this pandemic. And we'll be delighted to make that announcement at the right time.
I know you've been making continuing plans to bring more test kits out to different school districts. Is there any plans to bring those to daycares or daycare facilities throughout the state?
We have been making them available to congregate settings for sure. See, we've had to focus on priorities. Keeping kids in school, number one priority. Number one priority. Other states have not responded the same way. And I've heard from some of, anecdotally, people are saying, how did they do what they did in New York? By being prepared, being ready to getting the supply we needed in advance, getting them also out to nursing homes. I cannot say enough about nursing homes. It's frustrating for me because I want to be able to protect people even more than we're allowed to under the current federal laws. But people are now required to wear a quality mask when they arrive. They should be vaccinated. They should be tested. We just can't mandate it at the time. But daycare centers are really important. If there's daycare centers that need help from us, we'll be very happy to answer that call. So you can my answer that. Are you ready for that? We'll be able to handle.
Yes.
Okay.
The first deliveries to daycare centers, those that are regulated by the state OCFS, will be happening this coming week.
Okay.
Bill, give Bill the last question.
Okay.
Governor, there have been a lot of environmentalists grumbling that your proposal to ban fossil fuels in new construction by 2027 is way too far off. Are you open to moving up that date? Like, I know there's a legislative bill that would do it by 2023, I believe. Is that something that you would consider?
You know, the issue is that construction projects are long-term planning. You don't build and open a building in 2027 like that. It takes years of planning and getting site approvals and reviews. So in order to make sure we get the right timing, and again, I'll have these conversations. I'm going to be having many conversations with the legislature to work collaboratively with them. So it's something we'll talk about, but I also have to make sure that I give the builders, the developers, enough time to do what they have to do, changing materials, perhaps changing contents, a lot of changes that have to happen. And people are already making longer-term plans at this time, but it's something we'll be happy to look at. But I would also say is, well, I've had a lot of questions. An important question I'm going to ask is, will I be at the game? No. I have to tell you, as much as I'd love to be at the game, I'll be here with the TV on one side and have my budget director with me right here as we are talking about a budget which will be presented literally in a matter of days. So those are my priorities. But I will also tell the world right now, if the Buffalo Bills make it a Super Bowl, you'll not find me here in the state of New York. I'm going to be on a plane, and I'll be heading out to Las Vegas. So let's, Dr. Bassett, what do we say when we greet people in West New York? Say it again.
Go Bills.
Go Bills. Okay, go Bills. Thank you, everybody. Appreciate it.